Welcome to the channel. We're going to try and get some understanding. I'm your host, Dr. Darrell Ellis. And of course, the name of the channel is Getting Understanding with Dr. Darrell Ellis. One of the topics that I think I want to touch on today has to do with the new craze and also the new questions regarding the use of GLP-1 analog therapy for weight loss as well as for treatment of multiple medical problems. That's amazing that one class of drugs can have such a broad spectrum of possible uses. However, like Dr. Brown's old magic elixir, something that can cure a lot of things also has potential risk of causing a multitude of problems. And there have been a lot of things on the internet and in chat rooms about potential dangers of GLP-1 use. So I did a little bit of digging. I looked at some studies not only from the United States, but also in Europe and even in Switzerland and Sweden, looking into these potential risks. One of the things that has been talked about is increased risk of colorectal cancer. Indeed, although there have been some instances where people who've been using GLP-1s have developed colorectal cancer, all the actual research, the longitudinal research over a period of about 10 years, demonstrate that really GLP-1s seem to decrease the overall risk of colon cancer. Another issue that has been also mentioned is the increased risk of pancreatitis. Well, that's a pretty well-known risk factor for GLP-1 use. Unfortunately, in patients who have not had a prior history of pancreatitis, it doesn't seem to increase the risk of developing pancreatitis. But if you've had a prior history of pancreatic issues or pancreatitis, particularly if you've had a history of alcohol use, which sometimes can be associated with excess weight, it does increase your risk of having accelerations or exacerbations of a pre-existing history of pancreatitis. The same thing is true for thyroid cancer. There's been a link between a specific type of thyroid cancer that's genetically mediated, called medullary thyroid cancer or multiple endocrine neoplasia. It's genetically linked. If there's a family history of that, and you absolutely should not use a GLP-1 analog because it can unlock that genetic predisposition and manifest disease in you. That disease might manifest anyway, even if you're not using GLP-1s. But there certainly has been a correlation between people who are at risk for that and then develop it once they're on GLP-1 analogs. So as such, that now is a black box warning on the use of GLP-1s. Another potential risk is that through diabetes, if you develop what we call gastroparesis, or numbing of the nerves in the gut that slow your ability to empty your stomach after you eat, use of GLP-1s can exacerbate that significantly, as that's actually one of the mechanisms of action of GLP-1s. And that can result of increased abdominal pain, increased abdominal bloating, nausea, and vomiting. Some of the side effects that are common for GLP-1s, nausea and constipation, actually can be ameliorated just by watching your diet. There are certain dietary suggestions that you should follow if you're on a GLP-1. Make sure that you're eating a high protein containing diet. The reason being is that GLP-1s will pull weight, but not just from fat cells. It can also cause what we call sarcopenia, or wasting of the musculature. So it's important that you have a diet that's high in protein to replace the muscle mass that you might be losing. And accompany that with being sure that you're doing some regular exercise, resistance training, as well as cardiac exercise to help maintain that lean muscle mass. And then lastly, one of the other risk factors is constipation, nausea, and vomiting, or gastrointestinal side effects. By making sure your diet is high in fiber and that you're drinking plenty of water, you can actually ameliorate those side effects as well and make it so that you can tolerate the medication better, titrate doses to higher doses that are more effective for you if you're trying to achieve certain goals in terms of your glucose control or weight loss, and allow you to stay on the medication for longer periods of time so that you realize some of the more long-term benefits of the use of these medications. So much of what you hear on the internet in terms of risk factors and side effects, some of which may be realized if the use of the medication is in the wrong patient population, but for the most part, the research actually shows that the benefits by far outweigh the risks in most patients that this treatment is a viable option for. So do your own research. Make sure you have a good family history before you consider going on the medication, and talk to your doctor. make sure that he doesn't know of any contraindications in your medical history that would prevent you from being on this medication. It might be very beneficial for you. Don't forget, I really enjoy hearing from you guys. So I'd love for you guys to be able to send me questions or requests for additional topics. But in order for you to have access to those, I need you to hit that like button. That helps us with the algorithm on YouTube so that our videos will get posted quicker and be up on the top of a channel. Hit that subscribe button so you're early on in the process of being notified when we roll out new data. And definitely, let's get a conversation going about ways that I can give you more information that's applicable to your questions and your concerns. God bless you.